Hi guys, Chris Duquemin, the body engineer. I've been asked to do a short video to put my engineering take on the symptoms that many people with IH experience, as I firmly believe many of those symptoms have a mechanical root cause, and I want to explain that in a little bit more depth for you. Before I do that, I need to make a couple of things crystal clear. Firstly, in no way, shape or form am I advocating the methods that I promote and actually undertake as a replacement for conventional medical wisdom. I'm an engineer, right? So at the end of the day, it's about gathering as much diagnostic information as you can. And the results of scans, x-rays, blood tests, etc. That is all valuable diagnostic information, because at the end of the day, we need an evidence base to formulate a program of treatment. So most of the people that I treat, they've come to me with symptoms, but there's no clinical evidence base to support a program of work. They've found nothing wrong with that person with the scans, x-rays, blood tests. So from a medical perspective, it's very difficult to formulate an evidence-based treatment program when you can't find anything wrong. So my take on it is a little bit different. I firmly believe that the body has this innate ability to self-heal. It can fix and repair itself. So my job when somebody comes into the clinic, irrespective of their symptom, is not to try and fix and repair them. It's to ask the question, why can't they fix and repair themselves? Because if we can restore that function, if we can clear the roadblocks, reinitiate the capacity for self-healing, that person doesn't need me anymore. Their body can take control. How do I diagnose? Well, at the beginning of the assessment process, that is the most important few seconds that you have with that person. When they come in the door, yes, you look at the consultation form, you look at the list of symptoms, but you need to make an accurate diagnosis from an engineering perspective in those first few seconds to be able to determine not necessarily what's wrong with the person, but what's not right. Because I firmly believe, without exception, a lot of the chronic cases that I treat, it's very rarely as black and white as this causes this. It's usually a cumulative effect of whatever that person's been through in life. Old injuries, old traumas, a combination of all of those added together cause the symptom that they have. So it's a cumulative effect of whatever we've been through in life. And this is exactly the same as when I work with people with post-traumatic stress. It's a cumulative effect. Our bodies are walking, talking library books of unresolved trauma, both physical and emotional. So at the end of the day, we need to understand how the central nervous system works, because the central nervous system, the brain and the spinal cord, fundamentally is a bit like the fuse board that controls everything in the body. So common sense dictates if the fuse is tripped, the lights ain't going to come on. Don't complicate it more than that. But to understand how the central nervous system functions, I want you to visualize a balloon in the shape of a tadpole. So the head of the tadpole goes around the brain and it molds to the inside of the skull plates, and the body of the tadpole travels right the way down through the back and mechanically connects to the tailbone S2. So what we have is our master computer, the brain and spinal cord, floating inside a sea of fluid inside a tadpole-shaped balloon. Just have that visualization. Put it down on paper if it helps. Biomechanically, we mentioned there's a very strong connection to the inside of the skull plates, but there's a mechanism in the center of the brain called the ventricular system. And what this little fella does is, roughly in a rhythmical cycle every 3 to 4 seconds, it produces fluid called cerebrospinal fluid to nourish the nervous system. So basic mechanics, guys, this isn't rocket science, yeah? We've got a balloon, fluid's introduced into the balloon's going to expand. So what happens is, during the birth process, all of our skull plates implode, they fold in on each other to facilitate the easiest delivery for mum and baby. Now when the umbilical cord is cut, a combination of this cerebrospinal fluid production and the neck muscles, the sternocleidomastoid and trapezius, will stabilize the skull on the top of the neck, and that becomes the foundation for natural health and development. So quite often that's where things go wrong. The vast majority, I'm talking over 90% of the chronic cases I treat, not just IH, but many other chronic medically undiagnosable symptoms, there is a physical trauma at some point in that person's history that has put pressure on the developing central nervous system. So at that point, the body loses the ability to self-heal. It has to start spinning plates. It develops compensatory patterns to work around the issue. So let's go back to an ideally balanced body. We've got the brain and spinal cord floating inside our balloon. Every 3 to 4 seconds, the cerebrospinal fluid is produced and the balloon expands. As the balloon expands, we mentioned as babies that our skull plates implode. After the birth, the skull plates widen, and at 5 months old, they begin to knit together to go on and form the adult skull. But there's always an expansion joint there. So what happens is, as the CSF is produced, the balloon expands and the skull plates widen. 3 to 4 seconds later, that fluid is absorbed back into the blood supply and there's an inward rotation. So there's this constant expansion and contraction that's taking place. So again, you don't have to be a rocket scientist to understand that if those plates are jammed and we're not getting a lateral expansion during the CSF production phase, what's going to happen? There's going to be an increase in pressure within the cranium. Yeah? It's like squeezing a balloon. You don't just apply pressure where you squeeze the balloon, proportionally you increase pressure through the entire balloon. So because of the shape of the membrane that houses the nervous system, this tadpole shape, you can fall over ice skating, you can slip on a step and damage your tailbone. What have you done? You've traumatized one end of the mechanical central nervous system, because the occiput, there's a very strong molding to here, and we mentioned the connection to S2, so that as the membrane expands, a bit like two ends of a swing boat rocking and rolling, the occiput, the base of the skull, and the tailbone rock down towards the feet when the fluid is produced, and back up towards the head as the fluid is reintegrated back into the blood supply. So the mechanical surface that provides is it drags the body of the tadpole, the body of the membrane, up and down inside the back to keep all the individual nerve endings free and lubricated so they can send unhindered signals around the body. So it gives us a relaxed parasympathetic nervous system, which is the foundation for healing, good immune system building, digestion, etc. So anything in a nutshell that puts pressure on the balloon, on the central nervous system, your body senses as a direct threat to your survival. So it will adopt a fight or flight state. It drops into fight or flight, out of the parasympathetic and into some degree of sympathetic. It goes into self-preservation and protection mode to say, hey, something's not quite right here, I need to check it out. So all of a sudden, things change. A little switch is flicked, because in an ideally balanced body, we're in our relaxed mode, we sense a threat, we drop into fight or flight, the threat passes and we go back into self-healing mode. What I find with the chronic cases that I treat is that something has happened, there's a mechanical pressure usually applied to the central nervous system, so it loses the ability to drop out of that in alert state. And this is why people have a wide variety of symptoms, which medically are often treated in isolation. We've got the IBS, we've got hiatus hernias, certainly digestive issues, reflux, pressure around the chest. We'll have respiratory problems. There's often conditions with the heart as well, cardiac. Low heart rate variability is very, very common because it's a state of imbalance within the central nervous system. So for me as an engineer, it's about making an accurate diagnosis the first minute somebody walks through the door of what is compromised with that person's central nervous system. And we do that very simply and very safely, and I've shared this with many, many people over the years. We do a lot of work with children with special educational needs. We treat a lot of chronic medical cases, and this simple test will prove conclusively that there is an imbalance with the central nervous system. And all you do, you ask someone to open their mouth as wide as they can, have a look in the roof of the mouth, and you'll see a little dangly bit that sticks down called the uvula. The muscles directly above the uvula, the levator veli palatini muscles, are innervated by the ventral vagus nerve. So when somebody goes ah, ah, in quick succession, what you should see is the signal to the muscle in the roof of the mouth gets triggered, and you should see the uvula lift symmetrically like a puppet on two strings. Look either side of the uvula at the roof of the mouth for confirmation, and you might find that if the uvula deviates to one side or only one side of the mouth lifts, then that is clinical confirmation that the ventral vagus is dysfunctional. You can back that up by doing a very, very light squeeze on the top of the shoulder muscles, and you're guaranteed to find that one of the two sides feels distinctly tighter than the other. The trapezius muscle will be engaged. That's clinical confirmation that your jugular foramina, a little opening at the base of the skull, between the occiput, the top end of our swing boat, remember, and the bone behind the ear, the temporal. That junction is compromised, and that's clinically significant because it affects three of our main cranial nerves, 9, 10, and 11. It will tighten the sternocleidomastoid and trapezius muscles, which pull on the skull plates, and we lose the ability for an actual expansion. Yeah? So just think of your body as nothing more complex than a bag of bones held together with elastic bands. It's that simple. This is pure, simple physics and biomechanics. But nerve signals control muscle, muscle dictates structure, structure governs function. So if the jugular foramina is compromised, we have a blood supply draining from the brain back to the heart, one on either side. So again, if the jugular foramina is restricted, there's a good possibility that the blood supply draining back to the heart will also be compromised. So again, common sense dictates that if a volume of blood is being pumped up to the brain and the same volume can't drain back down, there will always be an increase in pressure. So there are several reasons why that simple test to confirm compromised jugular foramina via the trapezius and deviated uvula would give you symptoms of IH. Firstly, because we know that the skull plates are not going to be widening properly. That's the first one. Now that's going to directly affect the production and the reabsorption of cerebrospinal fluid. Second one is the sternocleidomastoid and trapezius muscles will be tight. Could be on both sides, it's generally just the one. So again, there's a mechanical pull on the skull plates to prevent that lateral expansion. Now if I get hold of a balloon, I've got my balloon in the shape of a tadpole, if I twist it slightly at one end, what happens to the other end? It just follows suit, yeah? So what happens is we end up with a restriction at the base of the skull, and that will manifest down in the lower back. So a lot of people will have hip problems, groin problems, pain in the lower back, hip dysfunction, all kinds of weird and wonderful stuff, because the swing boat is not rocking and rolling symmetrically down the center of the body. Pure mechanics, guys. Keep it simple. Don't overcomplicate it. The belief system I have is that the body can do all the complicated things, but it can only do the complicated things when the simple things are working. So my job is to identify where the simple things are not functioning. Where is the pressure applied to the central nervous system so that it can't work in a balanced manner? We clear the roadblocks, we restore natural function, and the body can fix and repair itself. It should not be a long process. So generally what happens is we treat someone. Once we've made our accurate diagnosis, we clear the restrictions. Within a matter of minutes, we will feel this expansion. People often experience on the couch a distinct sense of, as if someone's pulled a thorn out and the body just relaxes. Because you're using the anatomy of the body to work very gently, very non-invasively. A lot of people will fall asleep when we treat them. There's no manipulation involved here. Because you're working with the central nervous system, you've got to be gentle and respectful and non-manipulative. That's certainly my take on it anyway. So once we've restored the capacity for self-healing, bearing in mind the ventral vagus nerve controls the top third of the esophagus and heart and lung function. So a lot of people have hiatus hernias with IH. People don't make the connection that if there's a shortening of the top third of the esophagus because the ventral vagus is dysfunctional, it's going to pull the stomach up under the left ribs, and if it's been there for long enough, you're going to have a hiatus hernia. All these things are usually treated in isolation, but there's a common denominating factor. So if you have high H, my advice to you would be have a look in the mirror, get someone to have a look, open the mouth as wide as you can and go ah, 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 2 or 3 times in quick succession, and check if the uvula deviates and that the roof of the mouth lifts symmetrically. I haven't come across one single person with IH where there is a balanced uvula and roof of the mouth and the shoulders are not tight. Because the jugular furrow minor is always, always, always compromised. So I guess the purpose of me doing this video is to maybe explain mechanically that we should be investigating the path of least resistance before we look at surgical procedures. Let's rule out the obvious before we dive in and do the invasive. Yeah. So again, I want to advocate very clearly. This is not here to replace conventional medical wisdom. I work with a lot of medical people, and this is just basically looking at it from an engineering perspective, but using accepted medical knowledge and science and a different set of diagnostic skills. That's all it is. So this is just advice, which I'm hoping that other people may be able to put into their toolbox, because it's all about helping people. First, do no harm. That's the medical creed, right? So if we can find a clinical, simple, safe diagnostic test to prove at the beginning of the assessment process that there is a mechanical component to pressure on the central nervous system, then we need to rule that out before the invasive stuff. So that's the purpose of the video. I hope it's made sense. Any questions that anybody has, please feel free to get in touch, and I promise I'll help as much as I can. All right, you take good care. All the best.